So let's go on to our first briefing item, the Ann Arbor Public Schools COVID-19 Preparedness and Response Plan. Dr. Swift.
Thank you, President Johnson and trustees. I wanted to share with you this evening that how much we appreciate the work of Mr. Comza, Ms. Langford, and members of our team. We do have a number of plans that all fit together in the overall plan. And the ones this evening are really focused on ensuring the safety and clear protocols of our staff and any visitors, although we may not have very many visitors, our contractors, etc. And we, as you know, prioritize the safety of our employees. And so that is one part. And then the other component is really about those safety and protocols during the school day. I don't believe anything that these fine professionals are going to share is a surprise to anyone. But I will point out, trustees, that it's these two documents that are required to be approved by the board and to be submitted to the ISD, to governor's office via the intermediate school district. And so with that, I believe Mr. Comza has it all in order and ready to go.
Thank you, Dr. Swift. Good evening, trustees. The governor has issued over 150 executive orders related to COVID-19 pandemic. Two of the most recent have a direct impact on school district operations. But my guess is you will never be asked about what's in an executive order, what executive order's been overruled, what executive order's been overplaced. So we're not going to go down that rabbit hole. When my presentation is over, I want you and the listeners to be able to answer this question, which if you haven't gotten, you will get. And that question is, what is the district doing to provide for the safety of employees and visitors in our buildings and on our property to decrease the risk of COVID infection? In your board docs, you have the complete plan, the COVID Preparedness and Response Plan. It's called that because that's what the executive order calls it. Let's call it what it is. It's a workplace plan for employees and visitors. Workplace plan for employees and visitors. This workplace plan for employees and visitors has as its principal purpose, as Dr. Swift said, the decrease in the risk of infection for employees, contractors, and visitors to district buildings and property. Note, I did not mention students. That is because the return to school plan addresses students, and Ms. Langford will present that in a few minutes. My focus is on this workplace plan. This plan establishes a baseline for workplace rules and safeguards for districts, employees, contractors, and visitors. This plan establishes a baseline for workplace rules and safeguards for district employees, contractors, and visitors. It informs those entering our buildings and property of the steps the district is taking to safeguard health and safety and what is expected of those entering our district buildings and properties. So as we talk, and I just have a few slides and I'll tell you when in a minute, Andrew. So as we talk about this workplace plan, I want you to think of that question that you're going to be asked, what are we doing? And think of the plan as a regular school day, right? The start of the day before the building is entered. In the building, what actions and responsibilities are undertaken? And as Ms. Backler so amply addressed earlier, what steps will be taken if confirmed infection, positive test, or close contact with someone who is confirmed or suspected? And then, when can employees or visitors expect to return? And then we finish up with employee rights. So with that, Andrew, if you can go to the first slide. Okay, what do we do? School's not started yet. People are home getting dressed. Some are there, right? There is a daily screening protocol. Before entering a district building or district property for the first time each day, everyone must complete a self-screening questionnaire regarding COVID symptoms, which we hope to have available online or an app or be able to use on a Q code. And that you can find that. It's the CDC and Washtenaw County Health Department suggested questionnaire about the symptoms of COVID, fever, cough, fatigue, all the standard things that we all know about. Those have to be taken every day. If there is an affirmative indication of symptoms, which means if someone discloses that they checked one of those boxes, that person shall remain at home and not come into school, or if in the building, return home. The workplace supervisor, the building principal or designee, will notify then the executive director of HR or the executive director of the community division. And if that person is requested, they must submit to an interview. And I want you to know that there are consequences to those that knowingly provide false information or are deceitful on the form. There's a provision to, because this is important, there's a provision to discipline employees for that. And if we have visitors or contractors that are being dishonest, we can ban them from the building and take other extreme measures. These things are important. Next slide, Andrew. Okay, so now we're past that first step that I had talked about, the day's starting. Now we're in the building, right? What's happening in the building? What is the district doing to provide safety for employees and slow down the risk of an infection? Well, everyone knows about the social distancing. The 6-foot distancing, when possible, to the maximum extent possible, needs to be utilized. Face coverings will be worn in shared spaces, restrooms, hallways, and any in-person meetings. Any employee or visitor must self-report to their immediate supervisors of any positive COVID test, close contact with suspected or confirmed COVID-19 cases, or if they answered any affirmative answers on the screening protocol. Okay, a self-monitoring report as soon as possible and within 24 hours, as Ms. Beckler talked about, is required. If you test positive, you had close contact, or you answered affirmatively. Okay, this slide. What else are we doing in the business, in our buildings? We're gonna have signage that talks about spacing. We're gonna spread out workstations. We're gonna restrict the use of non-essential common spaces, cafeterias, lounges. We're providing additional training to all employees on workplace infection control, proper use of personal protective equipment, how to wash your hands, etc. Next slide. What else are we doing? Cleaning supplies will be available at workstations. Increased workplace cleaning and disinfection on high-touch surfaces and shared equipment will take place. Signs posted about the importance of personal hygiene, and we will try to minimize shared use of items in and around workstations. Next slide. Okay, and Ms. Beckler talked about this, and I was glad that she preceded me to take all the difficult questions. If there is a confirmed workplace infection, if on AAPS property, first of all, we'll isolate that person from others. If they're not there, of course, if this happens there, they don't come in. We isolate them immediately and make arrangements for that employee or that individual to go home and receive care. When an employee notifies the district of a confirmed case of COVID-19, the executive director of HR and/or the executive director of the community division, and maybe even these teams that Ms. Beckler is putting together, shall notify the Washtenaw County Health Department by use of their online portal, by email, or by phone call. And in the actual plan, there are links to all of those ways to contact WCHD. If this person visited a district building, we'll notify those in the area visited by the person. Those in close contact will be sent home. Close contact means within 6 feet, and it's now for 15 minutes. And as Ms. Beckler stated, you notify those who are in close contact within 24 hours. Okay, so the testing is done, all of these things. The next step is, when can I return? And as discussed earlier, pursuant to CDC, Washtenaw County Health, Michigan Department of Labor, if a confirmed diagnosis or symptoms you cannot return until at least 10 days have passed since the individual's symptoms first started or the first positive COVID test. As mentioned, at least 72 hours, 3 full days have passed since the fever is resolved without the use of fever-reducing medicines and individual symptoms have vastly improved. Now, what if an asymptomatic individual tests positive or has close contact with another confirmed or suspected case? As Ms. Backler pointed out, there is a longer period of time here. 14 days have passed since the testing or close contact occurred, provided the individual has no symptoms. If symptoms develop, the same as for confirmed, at least 72 hours, 3 full days have passed, and the individual symptoms have vastly improved. Next slide. There's also still a provision that if you travel internationally and come to the district within 14 days, you have to wait 14 days have passed since your return and you've not developed any symptoms, or at least 10 days have passed since individual symptoms first started or a first positive COVID test. And then, of course, the 72 hours, 3 full days have passed since fever resolved without the use of fever-reducing medicines. Next slide. Employee rights. There are a variety of virus protections for employees. There can be no discharge, discipline, or retaliation because of a positive COVID test, symptoms, or close contact. There's the Family First Coronavirus Response Act, which under certain circumstances gives employees an opportunity to have paid leave. And this plan, this summary of the plan and the actual plan, of course, can be amended if the laws or EEOC guidance or CDC guidance changes, and it seems to be changing daily, so we'll have that flexibility. There was a question earlier about securing this information. There's a provision in the plan that it will be secured, have limited access. We'll work with Dr. Kellstrom to make sure that we're able to do that. We have responsibilities under FERPA, HIPAA, and all privacy acts to make sure that information is contained, sealed away with limited access. So after seeing that, you should be able to answer, what is the district doing to protect and limit infection, COVID, for our employees and our visitors to our building? You had a preview of before school, what's taking place during school, what happens when there's a positive test or symptoms, and when can an employee return? And with that, I hope I didn't go too fast, but I tried to simplify it and keep it in that parameter without getting into the rabbit hole.
We appreciate it, Mr. Combs. Mr. Nelson, question.
I just have a quick comment that I appreciate very much this presentation. There's been a lot of emphasis in the school setting that we have things to learn about the transmission of infection from children to adults and vice versa, that sort of thing. But we do know a lot about the transmission between adults, and that we should not forget that part of what we need to do is to have the adults in the school very conscious of how their behavior can infect other adults. So I appreciate we're doing this. I do realize that there is a regulation underneath it that says we have to do it, but my sense, and I really appreciate it, is that we're doing it because we want to do the right thing for our employees and would be giving this careful attention even if there wasn't some regulation that said we had to pay attention to it. So thank you for a thoughtful piece on something that I think is often not emphasized as much as it should be, which is adult to adult transmission of the disease in schools.
Thank you.
Thank you. Trustees, any other questions? I actually had one quick question. So if an employee develops symptoms, and it was mentioned earlier that some symptoms do they're similar to flu and other ailments, is that employee required to take a COVID test, or would they have the option to not take the test?
We can't require an employee to take the test, but what we can do is before they return to work or want to return to work, they have to meet all those requirements set forth in the executive order. And I know that Ms. Langford's working with our clinical care doctors to see if we can provide, if an employee doesn't know where to go to get a test, or they just need help, and we can direct them to the clinic. And I think we're working on a plan to be able to assist employees in that. And most insurances now cover COVID tests without cost to the employee. So we would encourage it. We can't mandate, but we're working on a method where we can make that easily available to our employees.
Thank you. Trustee Lightfoot.
Thank you so much. I want to be clear. Did you say we can't mandate a test? That's correct?
Right.
And so then you've laid out well what we have to do, what our responsibilities. I want to hear this side of the employees. Do they have to alert us?
Yes. They have to take the daily screening questionnaire. And
Right.
if they have any of those symptoms, or if they check yes, or if they've had a positive test, they cannot return to the property unless 10 days have passed since the systems first started, or the first positive test. 72 hours, 3 full days have passed since the fever resolved without medication, and the individual symptoms have vastly improved.
Yeah. Okay. So we all have to work on the honor system, really.
Yeah.
Outside of whatever the tests that we do have result, the rest is the same with our children too. If they're sick,
Yeah.
letting us know. Okay.
Well, we have to work on the honor system, but people need to be honorable. This is an important piece of business.
Mm-hmm. Thank you so much.
Thank you very much.